Welcome. We are so glad to see so many of you joining us today for our inaugural Food for Thought dialogue series on food choices. This afternoon, we're going to explore how consumer psychology and our food environment are driving our decisions. My name is Gwendolyn Jones, and I'm the Executive Director here at IFINS. For those of you who aren't as familiar with IFINS, or the Institute for the Advancement of Food and Nutrition Sciences, allow me to note that we are focused on mobilizing government, industry, and academia to drive, fund, and lead actionable science that advances public health. We catalyze the creation of scientific knowledge and convene experts to support positive change. Our collaborative and inclusive structure empowers our members from government, industry, and academia to bring forward the diverse perspectives of the entire food and beverage ecosystem. As an organization, we are grounded on 4 core values: scientific integrity, transparency, collaboration, and public benefit. We know that it is the inclusion of diverse perspectives that is crucial to credible science. As a science organization, we are focused on connecting experts, collaborating with scientists, and catalyzing science that matters. As a new organization, we had the opportunity to do some reflection and think about the importance of dialogue as we look at shaping and driving positive change across the food and beverage ecosystem to advance public health. What we realized was this food and nutrition space that we all are part of is full of various seemingly disconnects. On one hand, you have malnutrition. On the other hand, you have obesity. On one hand, you have food deserts, and on the other hand, you have food waste. So within all of this, it's important to realize that it is those diverse perspectives. It is different areas of expertise that, when they come together, can all bring us to more holistic solutions. So with today's event, we're not looking necessarily at prescribing out any solution, but rather what we're looking for is an opportunity to encourage folks to perhaps think a little bit differently and expand how they are used to evaluating some of these key issues. Today, we're going to hear from a series of experts and some very big thinkers. And to help lead us in that discussion, I'd like to ask Dr. Neil Saab, our Senior Science Manager, to join us and walk us through what we're going to do this afternoon and help set us up for the rest of our event. Thank you.
Thank you so much, Gwendolyn, and welcome everybody. Let's start with a few housekeeping comments. We have about 400 participants on this webinar. It's a really good number. Because of that, we will be muting everybody for the duration. The way this is going to go is as follows. Jack Bobo will deliver his remarks for about 20 minutes. And this will be followed by a panel discussion for about 40 minutes between him and his fellow panelists. Following that, we will have about a 20-minute Q&A session with you. Please note that the bios for Jack and all the speakers are available on our website, and you're welcome to go look at it and everything else that you can find there of interest. And you can submit your questions anytime during the session. If you look at your control panel, there is a tab for questions. Go ahead and type them in. We will see them and we will ask them on your behalf. And we will do our best to get to all the questions, but if we don't, please accept our apologies in advance. So with that, it is my pleasure to introduce to you Jack Bobo. Jack is the author of the forthcoming book, Why Smart People Make Bad Food Choices. He is also the CEO of Futurity, a food foresight company that advises companies, foundations, and governments on emerging food trends and consumer attitudes related to the future of food. Jack is a global thought leader who has delivered more than 500 speeches in 50 countries. He was also recognized by Scientific American as one of 100 most influential people in biotechnology. Previously, Jack served as a Chief Communications Officer and Senior Vice President at Intrexon Corporation. And before that, some of us knew Jack when he worked at the United States Department of State for 13 years, where he was Senior Advisor for Global Food Policy. And again, I invite you to read Jack's full bio and that of the other panelists on our website. So with that, I hand it over to you, Jack.
Great. Well, thank you. And really appreciate the opportunity to be here with such a distinguished audience, but also a distinguished crowd. Let me lay a little bit of the groundwork here. Neil mentioned that I spent 13 years at the US Department of State working on global food policy. And during that time, I traveled to 50 or 60 countries, and every time I showed up, I would be introduced and people would say, oh, Jack from the Department of Agriculture, and I'd have to clarify, no, I'm from the Department of State. And then they would ask, well, what's the difference between what you do at the Department of State on food policy and what they do at USDA? And I would say, well, that's easy. At USDA, they do things, and at the State Department, we talk about doing things. And so that's appropriate here today because I'm going to be talking to you about my forthcoming book, Why Smart People Make Bad Food Choices. But it's really a book based on the work of registered dietitian, nutrition scientists, psychologists, behavioral economics, economists, and other economists. And I'm none of those things, but I am going to talk about some of the work that they've done and what I've learned by exploring this topic. And then I feel really fortunate that we have a panel of experts in those different fields who are going to be able to comment on some of their own work and how it relates to this issue of food choices, the psychology of food, and food environments, and how they influence the choices that people make. So as I begin, I just want to start out with the disclosure. I am the CEO of Futurity, which is a food foresight company that worked with food tech startups and big food brands, helping them understand what the future of food looks like, where consumer trends and attitudes are going. And so in that capacity, I consult with many food companies that are in the plant-based foods, cell-based, which is sort of lab-grown meat, as well as the dairy and livestock industry. So I work across that. I'm not really going to be talking about any individual companies today, and I'm not really talking about the work that I do with those companies, but just want to make sure that there's full disclosure as to what my private sector or corporate engagements are. So with that, I want to turn to the topic of our conversation today. And I want to start with the question of obesity, because that's really what got me interested in this topic to begin with. I had been doing a lot of work over the last 5 or 10 years around consumer psychology and looking at the food environment, but it was really that sort of big global challenge of obesity that intrigued me. And I really wanted to dive in and have a better understanding of how it all came about. Now, all of you on this webinar really know this topic so well and perhaps much better than me. But just to recap, today we have 42% of all Americans who are obese, and we're on our way to 50% by 2030, just 10 years from now, if we don't do something about it. So this is one of the greatest global tragedies of our time, and it's one of the biggest challenges that we all face. And so finding ways to understand how we got here and what can be done about it is just critical for all of us. Now, it's also amazing, though, how quickly things have changed. If we went back to 1975, pretty much no country in the world had an obesity rate above 15%. So most countries, it was 5 or 10%. And less than 50 years later, we find that most countries have obesity rates above 15%, and soon it will be all countries in the world will have that. And again, the United States, it's 42%. So it's just remarkable how quickly things have changed. And again, to put this into perspective, we often think of, the United States as being a place where obesity rates are just unusual and Americans are somehow different than the rest of the world because of our eating habits. But we forget that in 1975, only about 9% of Americans were obese. And in Europe, about 10% of people were obese. In other words, the obesity rates in the United States were actually lower than Europe. And it's not that long ago. So that's how quickly things have changed. And so it really begs the question, how did we get here? How did we get to this point where obesity rates were 42%, driving healthcare costs, one of the leading causes of death, and all of these negative consequences that follow from it? So I want to go back to the 1960s because in many ways, the American love affair with supersized portions can be traced back to the mad genius of one person, David Wallerstein. And back in the 1960s, Wallerstein was working for a chain of movie theaters, and he was given the job of increasing sales at the concession stands. And he tried all sorts of things to get people to buy more popcorn, but nothing seemed to work. And then one day, he had this insight. What if the reason people won't buy a second bag of popcorn is because they're embarrassed? They want the second bag, but they're embarrassed to go back and buy it because people might think they're gluttonous. And so because of that insight, he decided to offer the jumbo size popcorn. And of course, sales took off, not only of popcorn, but of sodas and everything else at the concession stand. It was a hit. And it's hard to believe that before that, it just wasn't something people did. And of course, long after that, it has become the norm. Now, he didn't stop with that single insight. He went on to work for McDonald's and do some work with them. And he told Ray Kroc, you need to offer larger sizes. And Ray Kroc said, you know what? If people want a second bag of fries, they'll just go order it. Well, we know that's not true. And eventually, he was able to convince Ray that he should offer a larger size. And so it wasn't until 1972 that he did that. And of course, the rest is history. One person influenced this. Now, it took decades for it to reach the point where we're at today, but it's hard to understand how quickly that actually changed and how completely different the world was before that idea occurred to David Wallerstein. Now, around the same time, in the late 70s, that the supersized portions were taking off, the US government was beginning to think about dietary guidelines. And again, you're all probably quite familiar with the story. And there was a question as to whether or not they should focus on fat or sugar or other things in those guidelines. And it was fat that won out that early debate. And the nutrition science had been really successful at addressing diseases and illnesses, over the previous 100 years. And so there's a lot of optimism that through the dietary guidelines, they were going to be able to address some of the drivers of cardiovascular disease and other illnesses by providing this information to the consumer. But what happened was, in many ways, unexpected. By telling consumers that you should lower your fat, it sent a message to food companies that they should offer low-fat products. Well, that seems like a win for consumers. If you're trying to reduce fat and companies are offering you low-fat options, then that should make you healthier. But what the government didn't think about, what the companies perhaps didn't think about, was the psychology of how consumers respond to these low-fat products that are intended to improve our health, but in many ways didn't have the outcome expected. And part of that is because of psychology. And one of those examples is the halo effect or the health halo effect. And again, you may be quite familiar with this. The idea that when a product has one good quality, like low fat, the consumer assumes that it has other good qualities. It's low in calorie, it's higher in nutrition, it has more vitamins and other things. They just assume that it has this health halo. And when a consumer thinks a product is healthier, then they want to consume more of it. And what this ends up happening is that you might have low fat cookies, and a consumer, instead of eating 3 or 4, will eat 5 or 10. And of course, if you eat more, you're not necessarily going to end up with that healthier outcome. So the product itself might be healthier if consumed in a normal quantity. The health halo effect can encourage consumers to actually eat more of it. This is just one of the examples of how efforts to improve health may have actually done just the opposite. Other areas where psychology is important relate to mental fatigue or decision fatigue. And we've all heard the idea or the recommendation that you should not go to the grocery store when you're hungry, or when you're hungry or when you're tired. And of course, that's when we tend to do it. After a long day of work, we go to the grocery store to do our shopping before we prepare our meals. And there's a lot of research that shows that when we're tired, either physically or mentally, we make worse decisions. And that's what's happening when we're in the grocery store. We're making poor decisions because we simply are tired. And of course, there's no place in the world that is worse for making good decisions, because you have to make so many decisions when you're in a grocery store. And it's not just that you're making a lot of decisions, it's gotten harder. One, we have busier lives than we ever have. But in just terms of products on the shelves, there are tens of thousands more products in a grocery store today than there were in 1980. So it is just more complicated. But also, because people are having busier lives, they're having to make tougher decisions. And the lower the income of the consumer, the harder it is. If money's not an issue, you can always choose the organic, or you can choose a different product because you want it. But if you're trying to balance the nutrition of the product, the cost of the product, the number of servings, the unit price, all of that can become quite overwhelming. And so again, that decision fatigue means that at the beginning of the shopping experience, you may go to the vegetable aisle, but by the end, you may be looking for products that are snacks and other things. And of course, that's why the candy bars and other things are right there at the checkout aisle, because the grocery stores know that people will want to reward themselves for having suffered through the mind-numbing experience of shopping. And so these efforts in terms of psychology are also leading to some of the bad choices that I was referring to. And the work of the International Food Information Council, IFIC, has also shown that in many ways, for most consumers, they report that deciding how to eat healthy is more difficult than doing their taxes. And that's painful to hear, because food should be something that brings people together and is an enjoyable experience. And yet it has become a source of stress in and of itself. It's become a source of confusion for most consumers. Now, some of the things that have been done to try to help consumers address this issue are through labels, nutrition facts panels, and things like that. But again, the research shows that they're not having necessarily the impact that one would have expected. When New York City put into place menu labeling before the federal government required it nationally, what they found was that for the first year, consumers reported noticing the information. But within 2 or 3 years, there really wasn't much evidence that consumers noticed the information at all. And it wasn't necessarily leading to better, healthier choices. And so having information isn't the same as using information. Most consumers report that they do use facts and nutrition facts panels in order to make decisions. But when you actually look at the behavior of consumers in a grocery store, in a real world setting, and you actually track the movement of the consumer's eyes, you find that most people really aren't using that information at all. And so giving people information that they don't use isn't necessarily helping. And so I want to give an example of behavior and how it can be difficult. And the example I want to give is from the Cheesecake Factory. And I'm sure you're all familiar with this company. And one of the things it's known for is for offering really large portions. And I'm a fan of the Cheesecake Factory. And a few years ago, I wanted to go there for dinner with my family. But I also wanted to kind of teach my kids a little bit about portion sizes and how to make sure that you don't overconsume. And so I ordered my food, and I got the steak, mashed potatoes, and green beans. And, I was kind of expecting the food to be overflowing the plate so that I could show my kids that, wow, this is just too much food for one man to eat. But when I got it, this is literally the plate that I got. I took a picture of it. I looked at it and I thought, I'm pretty sure I can eat all of that food. So I was kind of disappointed that it wasn't more food on the plate so that I could show them, what excess food actually looked like. Now, instead of diving into the food though, I reached into my wife's purse and I pulled out a 9-inch plate. My kids were a little bit embarrassed, as you can imagine. And then I replated the food onto that 9-inch plate so that I could see what it might look like on a plate that is the normal size back in 1960, but very different from the size of a plate we'd use today. And so this is what I found. When I replated the food, I realized that they had actually served me 2 full adult-sized meals. But when we're trying to decide how much we can eat, what we normally do is we look at the plate and we think, I can eat that. And so we're kind of eyeballing it. And because of that, the size of the plate has a big impact on whether or not we think we can eat it. And that's why I thought that I could totally clean my plate. And I realized that I might have done that, but I would have been eating 2 meals if I had done it. And so next I reached in my wife's purse and I pulled out a tape measure, again, embarrassing my children, because I just couldn't believe that it looked like so little food on one plate and it's so much on another. And I realized that the plate from the Cheesecake Factory was 15 inches wide and 12 inches deep. And because of that, what was really 2 servings of food didn't look like all that much food at all. And this is important because if you eat 2 meals for the price of 1, that will not make you healthier, and it probably won't make you happier because an hour or 2 later you're going to feel bloated because of it. On the other hand, if you get 2 meals for the price of 1 and you take one of them home, well, that's excellent value. And so it's not about suggesting that companies or restaurants are doing a bad service by giving us more food, but it's only a good deal if it actually leads to us having a healthier and happier outcome. So how do we reframe some of these conversations? What's the role of psychology and behavior in shaping these kinds of decisions? Because it's not just about information. I knew when I sat down, at Cheesecake Factory, that I should be aware of the danger of over-consuming food. I should be aware of portion sizes. But my brain, if I hadn't gone out and measured it, if I hadn't replated it, would have led me to make a bad decision anyway. Information on food labels and menu labels, nutrition facts, that information does not have as much of an impact as we would like. The fact is that consumers know more about health and nutrition today than they ever have in the history of the planet, and they've never been more obese. We have access to more healthy food in a grocery store today than we ever have, and yet we're still more obese. So how do we address this challenge if it's not an information problem, but it's an environmental problem? And that's probably the challenge that we have, is because it's not one thing that's changed. It's not just about changing our diets. It's not just about changing the plate size. Everything has changed. And so we need to find ways of reshaping our food environment so that it can begin to deliver healthier outcomes. And so how can we do that? Well, that's where I go towards the end of my book. And I'm drawing on research from people like Thaler and Sunstein, who wrote the book Nudge back in 2008, which had a big impact on how I think about this. And they were using behavioral science, cognitive psychology, behavioral economics to understand human behavior. And one of the things that they realized is that by simply changing some of the defaults, what the default situation is, sometimes you can dramatically change an outcome. One of the examples they talk about is, if you go to sign up for your 401k plan at work, well, if the box is already checked that you're a participant and you have to uncheck that box in order to avoid being in the program, most people will participate in the program. And if you have to check the box, well, most people will want to think about it and they might not end up participating. Same thing with organ donations when you go to get your driver's license. So the default decision has a powerful influence on what we do. And that has an impact in the food world as well. And we can talk about some of that when we get to the panel discussion. But I realized that there was this opportunity to use behavioral science to influence our decision. And so I went out looking for examples of what others were already doing in this space. And it led me to a surprising place. We know of Google as one of the largest companies in the world. It's one of the most admired companies in the world, but we don't necessarily think of it as one of the most innovative companies when it comes to food and nutrition. And yet they hired Michael Bacher 10 years ago to help them set up the food restaurants and cafeterias in their offices around the world. And one of the things that happened is that they were offering the best food in the world, and people were gaining enormous amounts of weight the first year that they worked for Google. And so he wanted people to have great food, but he also wanted to use food to make people healthier. And this led him as well to finding behavioral science. And he ended up working with the Yale School of Management's Center for Customer Insights to redesign the Google food spaces in order to guide people to healthier choices. And it's not about denying people the things that they enjoy. And that's what's important about the concept of nudging and behavioral science. It's about making the healthier choice the easier choice. And I'll just give you a few examples of things that they did. One of them is that people, of course, love soda. They wanted to make sure that people continue to have access to soda. But what they did was they took the sodas and they put them in a lower refrigerator instead of the upper one, and they put them behind frosted glass to make it just a little bit less likely that they would choose that soda. And they made the waters and spa water and other things easily accessible throughout the space. Other things they did were they used work from the Better Buying Lab, which is part of the World Resources Institute, to rename the products that are in their buffet lines to make them more exciting and more interesting. Some companies have explored these ideas. Instead of calling something, black bean soup, or a low-fat black bean soup, which might appeal to people that are on a diet, but might not appeal to just the average person, they found that if you renamed it Cuban black bean soup, that all of a sudden it sounded like something that was interesting and exciting and a positive experience instead of something that was going to make you less enjoyable because it was good for you. And they did other work where they separated the distance between the snack station and the coffee station. It takes 45 seconds to make that cup of coffee, and if you only had to walk 6 feet to get snacks, everybody walked to the snack station to get it. If they moved it 15 feet away, all of a sudden that just wasn't enough time to go and get a snack and come back, and people just consume less snacks. They took the M&Ms, which were free, and they put them in opaque containers. They only offered one color of M&M instead of all of the colors, because people just grab a smaller portion if it's only one color, even though of course they all taste the same. So all sorts of ways of nudging behavior. And this may not seem important, but Google itself, before COVID, was feeding 200,000 people 1, 2, or 3 meals a day, 5 to 7 days a week. And so these are important ideas, and they were able to work with the food service companies they work with, like Compass Group, in order to scale those ideas to the grocery store or to the hospitals and corporate cafeterias and schools that company works with. So how do we scale ideas? So, that's where I want to kind of leave this conversation and soon turn it over to some of the panelists to comment, is that, the challenge we have is to take ideas like those from Google, from programs like the Blue Zones that are looking at communities in America, Wellville, that's Esther Dyson's program, and other programs, and how do we take those different lessons that different organizations are gathering today and pull them together so that, again, our food environment can begin to work for us instead of work against us. Remember, in 1960, nobody knew anything about health and nutrition, and yet for some reason, very few people were obese. We know so much more today, and yet it's so much more difficult for people to eat healthy diets. We need to find a way of reshaping that food environment so that we can bring that joy back to food. Diets have not fulfilled that promise. There are more diet options than there've ever been, but if people can't stick to a diet, then it doesn't really work. Pretty much any diet works if you stick to it, but we just know that it generally doesn't work. Obesity rates are going up year after year, even though more and more diets are available. So these are some of the things that I'm hoping that we'll get into in the conversation with the other panelists. And I appreciate you taking the time. There will be an opportunity for you to ask questions at the end. So I'm going to give each of the panelists a few minutes to talk about what they do, and then perhaps respond to some of the things that I've said. And then hopefully we'll get into a dialogue, but there will absolutely be time for you to ask some of your questions at the end. And so with that, I am going to turn off the sharing, or they'll turn it off for me, and I will turn to our first panelist to give some comments of their own. So with that, Wendelin, do you want to take back the authority for sharing?
It's already been done, and we're seeing you, Jack, and Jason, and Taylor, and Jennifer, and Shutta on the screen. So terrific.
That's wonderful. So I am not going to be providing a long bio for each of the panelists. They're all quite notable in their own right. I am the only person who's not a PhD on this entire panel or webinar today. I like to tell people that I have 5 degrees, so I'm more about quantity of degrees. My wife has the PhD in our family, so she's more about quality of degrees. I know where this audience falls on those two options, so I won't get into a conversation about that. But let me go ahead and turn it over to Dr. Jason Lust to talk about where he is, what he does, and some of the research that he's done, because Jason is one of the best communicators I know, has written books on the topic, and it's always a must read for me when I run across his work on social media. So with that, Jason, please, over to you.
Thanks, Jack. It's funny, we have the same conversation in my household. My wife reminds me she has the same number of degrees I do, even though they're not exactly the same. So I enjoyed your presentation, Jack, as always, interesting and thought-provoking. So I'm a distinguished professor, head of the Agricultural Economics Department at Purdue University. I study what we eat and why we eat it. I am a food economist, food and agricultural economist, so I tend to be interested in those factors affecting food choices that tend to relate to prices, income, and other variables that economists often pay attention to. I've actually written quite a bit on many of the topics that Jack, you touched on. I have a 2013 book called The Food Police, and I have an article that asks the question, are you smart enough to know what to eat? And so very much touches on some of these topics, particularly in light of some of the work that was coming out that you mentioned by Sunstein and Thaler on these topics. So, you know, just in the spirit of good communication and healthy conversation, I'll maybe pick on some points, not necessarily of disagreement, but maybe push back in some areas. So, you know, the title of your book, I think, is interesting and thought-provoking. It asks why smart people make bad food choices. And one thing I might ask is, bad according to whom? So it's pretty easy for us to look out and see some of the trends that you mentioned that are troubling, whether it's the rise in obesity or diabetes. I think, you know, I would be disingenuous to say there weren't problems with that. Of course there are, but I think it's really hard to step into somebody else's shoes and decide, was that a good or bad choice given their circumstances, given their beliefs. And the other thing I'll mention, because I know we have some people much better trained in nutrition than me, but I'll say the goal in life is not to maximize the nutrient quality of our diet or the nutrition of our diet. It's to live a good life, an enjoyable life. And so we make trade-offs between things in life, the affordability of our food, the taste of our food, the convenience of our food. And sometimes that means we'll make choices that weren't necessarily the optimal in terms of health, but might be optimizing in some other dimensions. And so I think when we look at people's choices, we have to sort of take that net of all things into considerations and know that a choice that maybe looks bad in one dimension might look quite good in another. So actually, I like where you sort of ended up, Jack, talking about the role of companies and even individuals to think about our own choices. Certainly we make mistakes and think about how we can alter those. Often these conversations tend to go in a direction of, here's a government policy that can be enacted to solve this problem. And I think that's can be a big challenge because I think if people really, you know, do understand some of these behavioral biases, like you mentioned, being tired when you go in the grocery store, we might realize over time, well, you know, I'm making choices I don't really appreciate that my former self made yesterday when I was tired in the grocery store. We can learn from those, right? Or we can go out and seek the help of nutritionists or others to help us make those choices. Moreover, I think companies in competition with each other, yes, maybe it leads to the fact that I see McDonald's offering the super size, so I better offer it too. And so, competition can lead to outcomes where maybe there are more unhealthy options. But if people really want to eat healthier, good competition can lead to new innovations and new varieties that lead us to different kinds of choices. And I think even if we know we make decision-making errors, I think there are even really creative opportunities. So if we have these behavioral biases, so stick.com, for example, is a really interesting one. You can go basically make a commitment with your future self. I want to lose 5 pounds in the next 5 months. You put that goal in. You might even put in your credit card number and say there's an impartial referee, which says if I don't hit that goal in 5 months, you're going to charge my credit card. And oh, by the way, you can, if you want to really incentivize yourself, send that money to some organization that you really loathe, if you really want to ramp up the incentives. So the point is there are ways we can choose as individuals if we really have some decision-making biases to incentivize ourselves. And I really think that's the way I like to look at this. And I think, I think that's what's challenging sometimes in a lot of the policy approaches that we enact here are the regressiveness of some of them. It doesn't really respect the fact that people have different incomes and preferences. And the challenge that there's not that competition involved there, that if it's really something that's unpalatable or causes outcomes that people are really averse, you can't get away from it. But if you as a company are offering a set of choices that I regret every time I go in, I can go somewhere else. And that competition, at least on the margin, can incentivize companies to even think about offering healthier alternatives. So I'm looking forward to hearing what the other guests have to say. So I'm going to stop there.
All right. Well, I have a number of follow-up, but I will save those for later as well. But I have to say, I mean, I completely agree with you when it comes to policy interventions. And what I explore in the book is how do we as society reshape those decisions so that we can help ourselves. And the why smart people make bad food choices is really about, when people themselves are wondering why they make those choices. I think if the more we understand why we do it, and the more we can reshape our environment to help us, as you were suggesting, that's absolutely where I'm going with this. It's not necessary. And, later in the conversation, I want to turn to some examples like soda taxes and other things that I think everybody on the panel is familiar with. But yeah, I really appreciate those thoughts setting things up. And now I'd like to turn to Dr. Taylor Wallace and see what he has to say and tell us a little bit about who you are, what you do, and keep it to 5 minutes. I know you've done a lot, Taylor.
Well, I'm Taylor Wallace, principal and CEO at the Think Healthy Group, which I founded 5 years ago. Think Healthy Group really has an expertise in designing and executing research that can impact positive public health policy. And I disagree a little bit with the comments on effective public policy because I think particularly towards low-income individuals and children that there's actually some examples of where we've been very successful when we follow the science and not necessarily all the rhetoric. We do anything from large randomized control trials. I have my proudest moment is my clinical trial in Guatemala. I work with a nutrient called choline that's very involved in brain development in children. And we've recruited 1,200 individuals that are 6 months old, indigenous Maya individuals in rural Guatemala. And so we'll be looking at the effect of a 360-degree nutrition intervention, whether it's maternal education, getting multivitamin, multi-mineral supplementation to those kids, as well as the main component, one single egg a day. And so we're really excited about the potential for that in international policy, where I think that there could be some huge effects. Going back to your presentation, I think that a lot has changed since the 70s. We talk about the food environment, but I think the work environment's really changed as well. COVID-19 is a huge example of how we've all been sedentary over the last year. We've moved towards the computer, the TV, sedentary activities where I think, prior to the 70s, we were much more up on our feet and active. I also think there's a piece of the puzzle that, falls upon, scientists and regulators to better protect consumers. We have a fairly highly regulated food industry, but we don't have a fairly highly regulated, influencer community, whether that be advocacy groups. I mean, Jack, you and I have talked a lot about the environmental working group and how that deters some mothers from giving their kids conventional fruits and vegetables. I think there's, a responsibility, and one of the things that I do a lot of is try to communicate effective science and really battle like the misinformation that has been put out there by a lot of, whether it's self-proclaimed experts or special interest groups that maybe don't have a product, but they sure have a huge financial vested interest in the topic out there. And I see that growing every day. In regards to policy, I think, as the former chief scientist at the National Osteoporosis Foundation, I always give examples about bone. I'm a bonehead. I do a lot of bone research as well. But you look at the National School Lunch and Breakfast programs, giving milk to kids, and you look at how that has evolved and how calcium intakes and dairy intakes are really driven by programs like that in our country. I could argue the same with low income individuals with certain aspects of the SNAP and WIC program, where I think we've had huge public health successes with folic acid and other different interventions with that. So I actually, and maybe this is because I sit in Washington, D.C. and I've been a policy guru, my whole career, but I actually think there is a place for public policy. I think the key is effective public policy and kind of getting through the weeds of all these different interests.
Thanks for those comments, and this will be great. Hopefully we can get into a little bit of a back and forth with you and Jason over that. I think that there is a role for public policy. I think part of the challenge is when is it the right time for that, and when are there trade-offs in policy between one group and another. And as Jason mentioned, that many of these policies end up being regressive, and so would love to dive a little bit deeper into that as well as we move along. But right now, I would like to turn it over to Shweta Chakraborty, who is a risk and decision scientist. You may have seen her on CNN, Fox News, or dozens of other media sources in the last few months or even weeks. But Shweta, let you take it over and tell people a little bit about yourself.
Yeah, thank you so much. Fantastic discussion so far. I'd like to get into that back and forth with Jason and Taylor too, and push back a little bit. And I swear to the audience, we actually are all friends in real life, but this is one of those topics that you can't help but have an opinion on, especially when you spend your career working on it. But I didn't actually start my career in food or even climate, which is broadly what I do now. I'm a behavioral scientist, and I applied behavioral science to understanding why patients don't make the best decisions for ultimately the best health outcomes for themselves. And if you can't get an individual to make the best decisions for the best outcomes in health, how are you going to get society more broadly to make better decisions around not just individual behaviors like the food choices that they make, but broader at the community level around what needs to be done related to major community level and global risks that we face collectively. So once I started applying behavioral science to individual decision making and understanding that there's a real gap between perception, how individuals perceive risk, what actually influences that risk, and how it's not aligned to traditional economic theory. It's not necessarily to maximize utility, but that's how our systems have been designed, with the assumption that people are rational decision makers. In fact, we're not. And realizing that at that very critical decision-making place of your own personal health, that gap between perception and reality became very clear. So if we understand what the best outcomes around patient or food decision-making are, and yet that doesn't align to the individual daily decision-making of individuals, then what does that mean for more collective outcomes? And so that led me to thinking about how this can be applied to other sectors. And I was teaching a course at Columbia University on decision science, but they wanted me to apply it to carbon management, and I didn't know anything about it yet at that time. And my students actually taught me. This was over 7 years ago now. So that's when I became very aware of climate change and the very real fact that the planet is warming rapidly. And the trajectory we're on is not something we would want to wish on our own worst enemy. And so once that penny dropped for me, I started really investing the application of behavioral science into climate change and its many ripple effects. One of the main ripple effects being food insecurity, and the implications of what that means for decision making at the individual level and at the policy level. Now, to get individuals to change behavior, there's two things. One, individuals need to confront their own innate biases and recognize that there's cognitive triggers in the environment that are really influencing decisions and ultimately behavioral outcomes. And then we also need to create through policy a better choice environment, which Jack outlined in his presentation. That's the work of Sunstein and Thaler in Nudge. And those two things really need to work together, and they mutually reinforce each other. And once you have public will actually influencing political will, you can begin to see some more broader sweeping changes through society. For me, the way I approach this webinar and the topic here is that food choices aren't just about individuals, and what Jason was saying about there might be different preferences that are rational based on different cultures, but there's a bigger issue here that I want to just set this context in, which is these choices need to be aligned to the actual collective risks that we face. There's no such thing as decision making in silos. Individuals, even when they're making a choice about their own health, whether or not to take a prescription drug, that decision impacts a broader society. And we live in a collective shared landscape, and we need to remember that. So food choices need to be aligned to the policies that need to be put in place and entrenched in the reality of the data that the planet is warming. We need people to make better food choices so as to not increase the likelihood of infectious disease outbreaks from occurring, for example. That's one example. And these things are all connected and they're linked, and it's complex and it's very overwhelming too to our brain, because we're not designed to be able to contend with these really complicated, complex risks that our ancestors never had to worry about. Our systems of processing information are designed to judge a risk and make a quick snap decision around what to do. That's system one, that flight or fight response. But we're now engaging in much more complex decision making, and it's more important than ever that we're thoughtful about it and we confront our innate biases and we make decisions that are aligned to the reality of the risks that we're facing. So I'll leave it there, but really excited to get into this conversation. Thank you for having me.
Great. Well, thank you, Dr. Chakraborty. And yes, there's a lot that we're going to be able to tease out of that, and I'm really looking forward to diving into some of those questions. Perception of risk versus actual risk, and also just we talk about helping people to make better choices, but often those are choices that they want to make. 9 out of 10 people do not get the recommended servings of fruits and vegetables. And most people actually want to get that. It's just not happening. And so, if your interests are aligned, then, that's a good opportunity to use these behavioral interventions and nudges to help people do what it is they actually want to do. Now, there are obviously situations in which the interests of people and society could be different, but in many ways, here in America, we need in general to be consuming less, and that's going to have positive implications for some of the things that you're talking about. But now I'd like to turn to Dr. Fisher to tell us a little bit about her research at Temple University and some of the work she's done in these areas, particularly related to children. Really excited to hear about what you're doing. Only gotten a chance to take a look at some of the articles that you published, but it's great to have you here because you have real world experience in this area in terms of research.
Oh, well, thanks, Jack. It's a pleasure to be here and to be a part of the conversation. And I would say I've just been sitting back listening with great interest to the perspectives. And I would say that, from my perspective and the angle of my own research, we think about children's choices, right? And how do we develop and promote healthy behaviors in kids? And that really leads us back to many of the same issues that you've discussed in terms of, the environments that kids are in and who is caring for kids and the choices that those individuals make. So just by way of introduction, my work really seeks, I'm a basic behavioral scientist. I'm a nutritionist. I was trained by a developmental psychologist. And I'm really interested in understanding how we can raise kids to learn to like healthy foods, right? And enjoy those foods, importantly, but also to make sure that kids have healthy appetites and growth, right? And it's funny because when I started in this area back in the 1990s as a graduate student, it really wasn't a legitimate area of study, to be quite honest. And it wasn't until scientists realized that the changes in obesity had happened over such a short period that we really weren't talking about changes in our genetics, but changes in our behavior and in our environment, right? And which led to questions about what are the contributing factors. And then, of course, as we know, in the decades that have followed, we've realized that obesity is very difficult to address once it's established. And it's led us to focus on prevention, primary prevention, which is essentially how do we promote healthy eating behaviors in kids. And I guess from my take, and it'll be interesting to talk about the policy issues because I do have more of just opinions rather than specific studies. But one of the things we know about kids and eating is, you know, our taste preferences have strong genetic basis, right? Biological basis. Well before the time kids ever taste their first solid foods, they prefer sweet taste, right? They prefer savory taste. They reject sour and bitter. And so we know biology is a huge driver of the way that we behave in the current environment. And that's really not debated. But one of the things that I don't think is really appreciated is that children's food preferences are entirely learned through experience, right? And so how do children learn? It's fundamentally through the environments in which they experience food and their experiences around ingesting those foods, which are inherently social, right? And so that brings me to, I guess, the lens that I would bring is that, you know, for young children, families are really filtering the broader environment, talking about, you know, the setting up the environment in a way that makes a healthy choice the easy choice. Well, children aren't exposed to broad environments. They eat at tables in their families. They eat at schools, at their grandparents' houses. And so it's really those micro environments that are that very fundamental drivers. And what we know about kids eating is, you know, kids eat what they like. They're not thinking about price. They are not, most kids, and I would say that now kids are thinking more about sustainability than they ever have, including my college students. Take my classes, but for the most part, kids eat what they like. And what's really important is kids like what they know. And so understanding how to structure those early environments to really set kids up to facilitate those better default behaviors is key. And I think of one story, my kids, I remember going to a Halloween party when my kids were in first grade, and you know, there was a whole spread of donuts and chocolate, all the things you would expect, and then a little plate full of like oranges, right? Someone felt very good about bringing these oranges. Were they touched? No, absolutely not. Of course not. You know, and our biology would tell us that that would be very unlikely, right? And so it's not really, you know, are we trying to create behaviors where kids are choosing, you know, things that are less energy dense and healthful over sweets? That's not it. It's really creating the environments where kids makes it easy to make those choices. And so here's where the policy piece comes in my view. So obviously, you know, kids start out at home. Vast majority of their calories are consumed at home, but we know that when they head off into childcare and into school systems, you know, the behaviors, the policies that go into place that shape the foods that are present and the policies around food dictate those micro environments. And so in the case of competitive foods, right, school food lunches, what we've seen is that, you know, now with new regulations on competitive foods, we're seeing slight changes in what kids are eating. Previously, my kid was in first grade and participating in the school lunch program, very proud to support that. But what I learned was that he was actually purchasing a la carte fruit gushers and pizza every day through his optional purchases. Am I a bad parent? Did I not teach him well? Was he making bad choices? I don't think so. He was making choices that our biology would say are reasonable choices, right? But it's really the policies in place that allowed those behaviors to roll out. And so I would say that policy is important, although I have a very good example of school breakfast and the rollout of school breakfast that shows that evaluating our policies is critical because of the unintended consequences. So I'll be really interested to hear more about the perspectives of others.
Yeah, so let's dive into that question a little bit of, choices and consequences. Maybe turning back to Jason to talk a little bit about, some of these trade-offs. I often hear that the reason people are making bad food choices is because cheap food is too cheap. Bad food is too cheap. And so maybe you could tell us a little bit about, one, why are, arguably the fruits and vegetables more expensive? Why are, what's the impact of subsidies on the price of processed foods? And, just give us a little bit of the economic situation. I think that would be helpful context.
Yeah, Jack, that's a big can of worms. Is it more expensive to eat healthy or not? And the answer is it largely depends how you measure it. If you want to calculate dollars per calorie, well, lettuce is going to look really expensive. There's not many calories in lettuce. But if you make so in that kind of context, it makes it look like unhealthy diets are cheaper. But if you change the metric to something like dollars per pound, or even dollars per some kind of nutrient density index, it's a much more nuanced story. So it's a little unclear. It depends how you want to measure it. One thing that I think there is fairly good evidence for is that demand for healthy eating increases with income, even holding prices aside. Some of that may result from better knowledge, and some of it just may do with the basics of sort of moving up Maslow's hierarchy of needs, so to speak, if you will, and an expectation that investments in your health will have longer term payouts for you. You ask about the role of policy and farm subsidies on prices. I think in general, the research would suggest that farm policies have a much smaller effect on retail food prices than most people think. A couple of reasons. One is that the farmer's share of the retail dollar is fairly small for most food products. So, when you spend $1 at the grocery store, the amount of that is because of the cost at the farm level, probably, depends on the food, but it's maybe 10 cents to 20 cents. So if you make that farm commodity cheaper, it'll have an effect, but a muted effect because of that kind of small share of the farm to retail dollar. By the way, that's not necessarily a bad thing. People sometimes interpret that as like farmers are getting screwed somehow. I think what it really is more of a signal of is all the stuff that happens to food after it leaves the farm. A lot of processing, packaging, advertising, all the rest. And I think as a broader comment, I'd say farm policy is extraordinarily complicated, and you have policies that are pushing against each other in all kinds of different directions. But by and large, ask yourself a simple question: would farmers advocate for policies that made the price of their commodities cheaper? Generally, no. Now, some policies do that, but generally, farmers aren't going to be very, in favor of those kinds of policies. So take something like corn, probably the largest commodity that's grown in terms of acreage and dollars of production. You have policies that might push the price of corn down. So we subsidize, crop insurance. We have various risk mitigation policies. Those probably make corn cheaper than it would be otherwise. But by and large, the biggest policy that affects corn prices is ethanol policy. That comes out of the EPA, not USDA. So that, about 40% of corn goes to ethanol, goes to feeding our cars, essentially. That drives up the price of corn quite dramatically. It makes corn and by consequence, high fructose corn syrup much more expensive than it would be otherwise. Moreover, we have import quotas on imports of sugar, which is sort of a protection for our U.S. sugar
Sugar beet.
producers, which makes sugar more expensive than it would be otherwise. So I'm not a big fan of most of those policies. I think a more transparency, simplicity would be a good thing. But I think that even if we got rid of every kind of farm policy subsidy, the impact on the retail food price would be very small. Might be a little higher, might be a little lower, depending on the particular commodity in question. But by and large, it's I wouldn't say the culprit behind some of the poor food choices that people are often blamed for making.
Mm-hmm. Yeah, so I guess in context, it's a $1 trillion industry and $20 billion in subsidies for all of ag, and so it has a pretty small impact. And as you said, high fructose corn syrup. The reason we use it is because we have the most expensive sugar in the world, not because we have cheap sugar. And so yeah, so it's good to understand those differences. And I think it's important because if we're going to have policy implications or try to have change, we need to understand what's actually happening versus maybe what we think is happening with the food system. So Shata, maybe you could say a few words about this question of cheap food, though. I mean, one thing that I find interesting right now is in this plant-based food debate. Many of the companies keep talking about, we need to make plant-based food cheaper. And, I scratch my head a little bit because I don't know anybody who wants cheap food. And so, just from a communication standpoint or from, a behavioral science, maybe I'd be curious, how maybe should we be talking about healthy foods? Because, just another example that when you tell somebody a food is healthy, they just enjoy it less, even if it's not actually, low fat or low sugar or something. If they think it is, they will report that it's not as tasty. And so, that psychology, pushes back against our efforts to give people healthy foods if they just automatically aren't going to like it as much, or, they don't want cheapness. So, maybe tell us a little bit about sort of that psychology, and then how maybe we can do it better.
Yeah, sure. It's not like cheap drugs, right? It's not like people will definitely prefer cheap drugs, but they don't necessarily want cheaper food because it leads to that perception that this is of lower quality or this is not going to be nutritious, and all kinds of associations become affiliated with these words. And that is something that is really intrinsic into how we perceive various stimuli that come towards us and decisions we need to make about the foods we eat, the drugs we take, places we choose to set up and build our homes. There's so much stimuli coming at us, and we need to make snap judgments to be able to get through the day. And so we count on these cues to allow us to do that, so we can just be efficient about it. But again, we need to be more thoughtful because the environment is just that much more complex now than it ever has been before. But what we need to do as communicators is make it very clear that it's never been a safer environment for consumers to make choices. This is the healthiest we've ever been. We're living longer than we ever have. And that comes down to real understanding and science and being able to detect toxicity in parts per, not even just million, but parts per billion. But when you communicate that to the public, all that they hear is, wait, you're saying there's still a risk? There's still like a 0.00001% chance that this might not be a safe drug or a safe food product. And so recognizing how consumers are triggered by various cues and how that influences their decision making is really critical for communicators to be able to use wording and phrasing that makes the most sense, that again is aligned to what we hope, not just what is best for the end recipient, at the risk of sounding too patriarchal. We want people to make better decisions for themselves, their health, their families, but also as decision makers and communicators, there's a responsibility to recognize that all of these decisions are part of a broader landscape, and individual decision making really doesn't exist in isolation. And so what is best for the broader public, broader society, even the global citizenry? So those two things really need to be thought of together at the same time. How to communicate in a way that people are interpreting it as is intended and is aligned to the actual base rate statistics of a particular product. If healthy isn't the right word, what is it? There's enough science and data there to actually be able to frame information in a way that is going to be received in the way that is intended. And that's really going to be necessary as we think about how to allow people to make better decisions for themselves and their communities. So let's not say healthy, let's not say food waste even, let's call something, and Jack, you and I wrote on this together. We don't have to frame something as a throwaway or as a food scrap, but let's call it garbage chic, perhaps. That simple tweak in how we describe something can make all the difference. So you are the pro at this, but rather than saying healthy, there's many ways we can frame a food to really and talk about how amazing the texture is, how amazing the quality is. It's not cheap, but it's very it's actually cost effective. It'll fit into your budget much better. Wording things in ways that make it more positive, more aligned to how people perceive different products is going to go a long way in terms of ensuring that these decisions are aligned to the broader societal context.
Great. Yeah, I appreciate that. And, as you're saying, that difference between actual risk and perception of risk is something that, it took me a while to grasp that. When I was at the State Department, I used to talk about, risk being, hazard times exposure equals risk. And it took me a while to realize that I should be talking about hazard times media exposure equals perception of risk. And most of the time it was perception of risk that was really the challenge. And yet as a government, we were focused on actual risk. And it turns out that the public thinks in terms of hazards. If something can cause cancer, as far as they're concerned, it does cause cancer. And from a regulator's perspective, it's like, well, just because it can doesn't mean it does. But you can't unring that bell. As soon as you say something can cause cancer, consumers are going to be worried about it. Taylor, just moving on a little bit, how does nutrition science play into all of this? Because we obviously know a lot more than we ever have. You're doing amazing research yourself, and yet often what consumers hear are the nutrition science said last week that eggs are good and this week that they're bad, but now they're good again, or so how do we, is it a question of how the media reports this? Is this just the natural march of science? Or do the scientists themselves have a role to play in making sure that the outcomes of their research are better understood?
Well, in my experience, having been on the Dr. Oz show for the last 5 years, 5 seasons, so virtually throw your tomatoes at me, I've learned a lot. I came into this as a researcher, and I think as researchers, we're trained using the scientific method. And that's not, that's quite complex. Media, they have to get the headline. They need it to be sexy. They're trained to give a simple black and white answer. And there's a lot of issues with that. I also think that there's the issue with the media where they go into it thinking they know the answer. They're used to giving black and white answers. Things make sense to them. Shetha and I talk a lot about science versus logic. I think if you look at organic foods, logic says, they've got to be better for you. Science does not say that. I think if you look at GMOs, the same thing happens. Science says logic says that's frankenfood. Science says it's probably the best thing we've done in a very long time. And so, I think a lot of times the media makes sense logically of things, and I think they truly feel that. Look, everybody's an expert because everybody eats, and everybody thinks if they, I can't tell you how many times, I've worked with, an individual where they're telling me, my clinical trial, like, this is working so well and do this, and then they ended up being on the placebo. And so, I think there's a lot of that in the media, and I think they're very, they want the answer. I can't tell you how many times I've been on the Oz show where I've been told, we need you to say this, and I'm sitting there like, the script's already written, like I got to figure out how to make this Southern accent tone up and like be entertaining enough where the audience, like, where the ratings are up, where they'll actually have me back. And I think that's, it's in part, our fault. I mean, look, and I talk a little bit about, and I do a ton of randomized control trials and systematic reviews, but I think the scientific community, has moved so far towards solely relying on randomized control trials and systematic reviews that we've really lost sight of, the molecular biochemistry behind things. We've lost, track of the behavior science. Look, it's easy for the media to understand 100 people in the treatment group responded and 100 people in the placebo group didn't. It's very, very complex when you start talking about omics technologies, or why something, is regulating something else in the body, and why this makes sense biologically. And, that's a little bit more hard to interpret. How many headlines do you see that are driven by, molecular biology or omics technologies? Almost none, because the media don't understand that, and it doesn't give them a black and white answer.
Thanks. So I'm going to have to turn to the audience here soon, and I'll let Neil tee up some questions, but just to give him a heads up. Jennifer, could you either talk, give a couple of concrete examples of things that you found that were perhaps surprising or interesting, or if you want to go in a different direction and talk a little bit, you're there in Pennsylvania about, some of their work in Philadelphia on soda taxes, that's perfectly fine too. But just before we turn to the other questions from the audience, provide a couple of additional thoughts.
Sure. I realized that when I was, I really appreciated your opening slides on portion sizes and the role of the environment. That's really where a lot of my own research started out in the, I guess it was in the 90s, in children, and we found that children are very much more sensitive to these cues than was originally thought. The early studies said that children are good regulators of energy intake, and it's not till we become adults that we become susceptible to these things. But we know now that it's simply not true. And probably one of the most surprising things is how, I think, maybe not surprising things, but one of the things that has influenced my thinking quite a bit is that we now know that, children are very different from one another, which is not a profound statement, right? We've known this for a long time when it comes to eating behavior. The earliest studies showed huge variability. And what we've learned in the subsequent time is that a lot of behaviors that we consider to be under the auspice of free will and choice are actually highly biologically based. So even when we talk about, I always like to think about birthday parties. There are some kids who are immediately running outside and whacking each other over the head with their little trumpets and things, and then other kids are focused on the cake, right? When are we eating this? And it turns out that those sort of tendencies around food have a strong heritable component. They track within individual kids over time. And from a research perspective, this area of research is really, relatively new and has largely not even begun to touch on those differences, how we really address those. So thinking about policies, who do policies, for whom and in what context do policies, are they appropriate, do they work? In our behavioral science, what we're seeing is that kids who show those higher levels of food motivation or enjoyment of food are actually the kids who are most susceptible to some of these obesogenic dietary environmental influences. So we have data that show that kids who show high levels of food responsiveness actually are eating more when you serve them the larger Cheesecake Factory portions. And similarly, we see that kids who exhibit higher levels of enjoyment of food also are snacking more frequently and eating a larger percentage of their calories from snacks. And so I think what and it's where the field of obesity prevention is coming around to is that, our approaches needs to move away from a one size fits all kind of paradigm to really better address these fundamental differences in who kids are and how they approach eating.
Great, thank you. So Neil, I don't know if there are any questions from the audience. I'm happy to continue to pose some of the questions that I had prepared, but I'll give you a moment to see if you have any questions that you'd like to throw out for the group.
Thank you, Jack. This is really fascinating discussion so far. We do have quite a few questions, and I think some of them will pick up on tangents that have been raised so far. Let's start with one that's, let's just call it a sign of the times. This is a question about the growth of online grocery shopping during the pandemic. And what influence might have had this shopping trends on nutrition value, portion sizes, or just overall eating habits? And recognizing there's not a trend that affects everybody who's eating, shopping grocery stores.
So, Jason, have you been tracking that at all? Or I don't know if Taylor has been.
A couple brief comments. I don't disagree with y'all's comments earlier that people don't want cheap food, but people do like affordable food.
Yep.
And one thing we know from some of the economics research is that that's advantageous to moving more kind of food buying online is it makes price more transparent and it makes it easier for people to shop and compare across stores. So that tends to create competition and make food more affordable. And I think that as a good thing. I don't know anything about how it might affect nutritional choices, but one neat idea around the online food buying is you have the potential at least to perhaps create more control around your environment. And maybe Jack used some of those nudges or suggestions, maybe even use some other online apps to do your buying for that maybe can help you make choices that are consistent with kind of your longer term interests. So I think that's an interesting opportunity. I don't know to what extent that's being realized.
Yeah, I don't think it's been realized yet, but I think you're absolutely right that consumers might be willing to limit the kinds of choices that are presented to them when they're not hungry, and then they just won't know that they're not seeing as many of the things that maybe they like but don't want to put in front of themselves. We know thyself, I think, is always important.
It's like muting that person on Twitter. They can still be talking bad about you, but you'll just never know it and you'll feel fine.
Right. Well, and to your point about cheapness and quality and affordability, back when the U.S. and the EU were negotiating the TTIP agreement, perhaps my greatest success was convincing the U.S. Trade Representative's office to stop saying that the deal would make food cheaper and to get them to say it will make quality food more affordable. So that was my entire contribution to the trade deal over, I think, 3 years. Yeah, Neil, well, does anybody else want to jump in on that? And otherwise we can move on. Taylor?
I don't think we know at this point because, our National Health and Nutrition Examination Survey and other food surveillance surveys are behind in, when they capture the data and actually it goes public. It's, about a 4-year time frame for our National Health and Nutrition Examination Survey. But I can speak from data within the alcohol industry, which I follow pretty closely during the pandemic. And, there were a lot of reports about alcohol sales being skyrocketed through the pandemic. But when you actually look at the corporate data, that's actually not the case because restaurant sales were so far down. People, yes, purchase more from the grocery store. So I think it's how you look at the data, and I think it's on a very individualized level. You could say the same thing in the midst of the pandemic when we were all quarantined and restaurants were, pretty much closed for business for months. You didn't have access to fast food or restaurant food or some of these foods that are, quote, causing the obesity epidemic, but yet obesity, really increased for a lot of people during this time. So I don't know if we have really good data, even though cohorts out there are collecting it.
Well, I do know from my personal experience that reductions in time spent with you and Shutta reduced my alcohol consumption of Chardonnay, but that's anecdotal. Go ahead, Neil.
Thanks, Jack. This is really pertaining to the concept of food deserts that crops up once in a while. The question is, what about the question of availability of food as opposed to prices? In poorer parts of the city, underserved communities may not have access to the grocery store with all the availability that we have access to, and how does that impact the choices and eventually obesity?
Anybody want to jump in?
I don't want to dominate the conversation, but I probably have a bit of a heretical view. There's a fair amount of really good economic research on this question. There's sort of this debate about why are there fewer healthier options in some of these, quote unquote food deserts? Is it because people there have different preferences? Like if you put the fresh fruits and vegetables on the shelf, will they even buy it? Or is it other barriers or constraints? I think the evidence from the best studies seems to suggest that it is differences in preferences across different kinds of communities. That being said, I think this is, to the extent that people in the so-called food deserts want healthier options, and there's some other kind of structural barrier here. I think there's really awesome opportunities for innovation, and I've seen some really cool things where people have like mobile trucks that they'll bring into neighborhoods. I think that's regardless of what I think the research says on it, that's putting your money where your mouth is and saying, I think these are foods people in these communities want, and I think there's a business opportunity here to do it. So I think those are really, I'm really hopeful that maybe some of those kinds of opportunities, innovations might help solve some of the problems there.
Yeah, and from my own research as well, that it turned out not to be as easy as we thought. Just making food more available by addressing the food desert didn't solve the problem the way we might have hoped that it would. There's some interesting work that's going on in terms of food as medicine and food prescriptions, which I think is kind of interesting. It's a little bit strange that we think of if somebody stays on a diabetes drug for their entire life, the rest of their life, nobody's surprised that you're going to have to pay every day for the rest of the person's life. But if somebody said, well, what if we gave them a prescription of food that would actually control the diabetes? And they're like, okay, that's great, but when can they stop taking it? Like, well, maybe never. And it's like, well, that doesn't make any sense. It's like, well, but why doesn't it? You're perfectly happy to pay for a drug every day forever, but not to pay for something that keeps people from having that underlying illness, which itself causes dramatic cost. And so I think society is beginning to grapple with some of those incentives in our food system that might, allow payers in the insurance industry to, participate in health as opposed to respond to illness.
I just like to flag one innovation that I'm aware of. I was on a webinar through earthday.org with talking about this in particular, and on the panel with me was Eric Castro. His handle is Vegan in the Hood, and so he's from New York City, and he was bringing just awareness to the community that vegan options, the perception was that vegan options and fresh produce are more expensive. And that couldn't be actually more inaccurate. So it was a education campaign that was launched alongside actually making these options more available, and that has showed a lot of promise. And so he, through Vegan in the Hood, has been bringing in fresh produce and vegan options to bodegas around New York City. They're looking to now move into other cities that are historically have these food deserts in them. And Questlove is also working on this. Questlove is known for his music, but he's actually a big investor in improving this space, especially for communities that have been more historically disenfranchised. And he's actually focusing on Philly. So Jennifer, that might be relevant and interesting for you. Maybe we can talk about that offline, but there's a lot of interesting innovation and support in this space.
So Jack, just to keep things going, recognizing we don't have a lot of time left, let's try to get as many questions as possible. Just a question about Drunowski's work on economic analysis of food costs and healthy diets. Anybody wants to take a stab at what their opinion is on that?
Well, I'll take a stab because Adam is a good friend of mine. I think he's a brilliant scientist, and I think often in the nutrition research community, and I'll say this as a nutrition researcher in Washington, D.C., that we have a very northeastern centric mindset. I call it the white woman that shops at Whole Foods, mindset. And I think Adam Drunowski really puts the data to what's happening in rural communities throughout the U.S. I think his work's brilliant.
Anybody else?
I think Taylor knows the work better than the rest of us, so that sounds great.
Excellent. So here's an interesting question about motivation. What ideas can we think of about motivating people to make better choices? When you think about the question or to ask 24-year-old people as they become more independent in the food choices, and I would say maybe bring it out even earlier than that in the age category.
Let me say something, and then others are welcome to jump in. And I kind of wonder, if the focus on food choices isn't perhaps the wrong focus, because the more we think about counting calories and the healthfulness of the food we buy, the more we're just thinking about food. And, in 1960, nobody was really thinking about, how healthy, that pot roast was. And, while the food environment itself has changed, are there things that we can do that make those choices the default? And that means that in some ways you kind of take that choice mostly out of the hands of the consumer themselves. It doesn't make it impossible for them to choose something that's not healthy, but it's just a more natural consequence of it. Like we've talked about, most people don't get the fruits and vegetables that they know that they should be eating. Most people know that the salad is healthier. Knowing something and doing something are just not the same thing. And if you don't go to the fast food restaurant, you won't eat fast food. So there are a lot of things that happen before sort of that decision at the counter.
I would just add to that, there's different motivations depending on who the end recipient is and whose behavior we're trying to change. And we need to understand what those particular, if we want to group people, let's say, we can't examine everybody's brain, but let's say we group people together through some sort of thoughtful method, and then we actually construct what is the mental model of that group. So we understand what are the perceptions, what is actually the resistance to some sort of behavioral change. We need to do that work. We can't magically just come up with a solution and assume it's going to work, or even in a communication, dropping it into community and assuming it's going to be interpreted as we're hoping. There needs to be actual time and resources, and it's not expensive, but it's an approach that is robust and it actually yields results. So we need to do the work and understand what people's mental models are and map them and then correct for them through effective tailored communications. So the same group of people might not be motivated by health concerns, but might be motivated by moral concerns, or might be motivated by sustainability concerns in terms of their food choices. How will we know unless we actually do that research and ask those questions? So yes, there's some good practices in terms of understanding how to better communicate and motivate people, but to be really truly effective on it, you need to do the research and understand what groups' mental models are.
Great. So Jack, as we are getting close to the end of the session, let's give you a chance to wrap it up in a minute or two, and then we'll pass it on to Wendelin for her closing comments.
Great, thank you. So first, I would just encourage people that are listening into this webinar to consider following the people that are on the panel, whether on social media or to follow the research of Jennifer and others. There's a lot to learn, and there's some interesting things that have been done. I know that certainly Taylor, Jason, and Shetta and myself we spend a lot of time on social media, so you can find us all there. You can engage with us. Please consider reaching out if we can be at all helpful. But I would also encourage you to think about what it is that the people that are listening can do in their own organizations. Because I talk to companies every day and other organizations that really do want to help people to lead a more nutritious and sustainable life. And I think it's critical that we're all involved in this. The food environment is not just what happens in our home. It's not just the choices we make. It's the choices that we collectively make as a society. And so, I would encourage people to think about, what their organization can do in order to contribute, to the success of these efforts. And with that, I think I will pass it back to you, Neil, and Wendelin to close us out, but look forward to continuing the conversation in other places.
Thank you so much, Jack. Wendelin, back to you.
Absolutely. Let me start this wrap up by thanking our panelists here today. I think there was lots of interest as noted in the questions. Unfortunately, we could not get to all of those questions, but clearly the intent of the session was to provide some food for thought. And that came out just with the dialogue amongst all of you, as well as with the questions that came forward. So thank you for that. On that, I'll build on Jack's call to action that people reflect and think about individual actions and collective actions, and start to put in, of course, a pitch that folks who joined us today continue to join us and be part of our IFINS community. We are about connecting ideas, collaborating, and catalyzing science, because it is only when we bring in the different areas of study, the different viewpoints, and the different sectors that we are going to be able to bring forward positive change across the food and beverage ecosystem. So with that, I'll end with this, because there's sometimes some questions that come in and folks want to reach out to us, want to make the emails a little bit bigger. Thank you all for attending. Big thank you to our panelists. Please feel free to reach out to myself, Gwendolyn Jones, or Neil Saab, and of course follow us on social media and keep track of our activities on our website. So with that, happy Thursday, everyone.
Thanks so
Goodbye,
much.
everybody.
It's been great.
Thank you.